At a public forum regarding PFAS levels at the Hopkinton Public Library, Hopkinton Health Director Shaun McAuliffe revealed while PFAS remains a concern and can be found in many places, levels of consumption have fortunately dropped significantly.
We are getting exposures every day. It's where the dust that accumulates in our homes has a low concentration of PFAS in it. The wash water from our dishes has a low level of PFAS in it that's going into our septic systems. The wash water coming out of our washing machines is picking up PFAS from any stain-proof clothing that you have or waterproof clothing that you have. So it's everywhere. And what they started doing in Europe is realizing that we needed to stop allowing these materials to be utilized in products that were being sold throughout the country. The U.S. is finally catching up to Europe because the concern is that because it's everywhere, and I would argue that it's in most, if not all of us, they started becoming concerned that people who were exposed to higher concentrations could realize endocrine disruption, so in your thyroid, your hormones, and they're still investigating what other effects that PFAS can have. It can cause low birth weight. I don't think it's why I'm 5'3", but that could be part of it. It could cause other problems in children. They're talking about precocious puberty, but a lot of these studies are coming from like the Carolinas that have the plants that manufacture PFAS. So they're looking at what it's doing to people that are exposed to high concentrations, and they're concerned because they don't know at what level yet PFAS is safe, or if it even is safe. But I say, when you went to your doctor last, did they say you've got to reduce your PFAS concentrations? I'd argue no. And until that day comes, like with the concentrations that we're exposed to in Hopkinton, I'm confident that we're in a good place. Let's say 2000, the average person had about 33 parts per parts per billion PFAS in their blood. Now the average person has between 2 and 6 parts per billion. I've tested, I have 7.8 parts per billion. I blame it on COVID because I lived on a diet of microwave popcorn and basically everything that had PFAS in it, pizza. So we're seeing, considerable improvement on the blood level content in most Americans. And it's, if we eat, I would argue that if you tend to consume products that are less processed, that are more, organic or just natural, you should be able to see improvements in your overall PFAS concentrations. DuPont has started phasing it out. And what a lot of these corporations are doing, instead of having these long chain PFAS compounds, they are turning to smaller chain PFAS compounds, which in theory should be easier to excrete from the body after you're exposed to them. So the DEP, the EPA, and the companies themselves, probably because they're afraid of the lawsuits that are coming, are all taking action to reduce our PFAS exposure.
View the full forum at hcam.tv or the HCAM YouTube channel.